I guess for both of you, is there, like, I'm assuming you work on a global level, sharing all the gene defects found, or are you finding, like, certain countries you're not hearing what genes they're isolating? I saw a much bigger list than what I was expecting for today. But is that what you think to be the full list of possible variants, or are we still far away from figuring that gene side out?
Yeah, no, that doesn't happen. So there's no sharing really of genetic results that come from different labs.
Uh,
And nowadays, it would actually be hard to publish cases of ALSP because the medical literature focuses on the new, and it was new 10 years ago, 12 years ago. So beyond, well, now it's very hard to publish them. So no one is really sharing genetic information, and labs are very obsessed with privacy when it comes to genetic information.
Really?
So the focus really is on sort of keeping that confidential because there's its potential to identify people from a genetic variant because they're so rare and unique. So that
Okay,
doesn't really
I
happen.
never even considered that side as saying that one gene, you know who it is in a community,
It's
so good to know.
possible that people can know who the patient is, so
Yeah,
we don't tend to do that. No.
thank you.
Thank you. You're welcome.
Unless there's a doctor. And I don't understand everything, but the AARS2, is there did you say that there's a correlation between that and the CFSR1 gene?
So ARS2 and CSF1R, they're different genes. They do different things, and they're really different diseases, but they just look very, very similar. And so what we try and take from that is if two conditions look very, very similar, then there might be some shared overlaps there in what's causing them. But it's not my belief that they are the exact same thing. I think they're slightly different diseases that just happen to look very, very similar.
We had another question up here, I think. Oh, yes.
Is there any knowledge of the levels of microglia within ALSP patients? So the data you showed is for just typical, I guess, people, right? So is there an understanding of what the difference in levels of microglia populations are within the brain?
I think that's hard to say. So we know from the visual natural history study that levels of soluble CSF1R, which presumably relate to the number of microglia, are dramatically reduced in patients carrying a CSF1R variant. And we know that their microglia in brain pathology slices are abnormal. They misshapen, they accumulate this abnormal pigment. And there is some reduction of them, but I don't think it's a clear-cut case that you just have a complete deficiency of microglia. You do in people who have two CSF1R mutations, which causes a very different but related childhood onset disorder called BANDOS. So children with BANDOS seem to have vastly reduced or completely absent microglia. But it's a kind of a different disease, really, although it's on a spectrum, I suppose.
Yes.
I did have a question with the different mutations that you found from the UK Biobank. Thank you. From all the different mutations you found in the UK Biobank, were you able to correlate specific mutations with severity of the disease? And then did you see any patterns in those?
So we're kind of limited in the inferences we can take from the clinical information that's in Biobank because it's just a linked ICD-10 code. So it doesn't tell us anything about the severity of the person's symptoms. And we didn't really want to delve into individual people's linked healthcare records, so we thought it was more valid to look at them as a group. So we grouped pathogenic variants, of which there was about 25, likely pathogenic, there's about 107. And so it's just the frequency of that ICD-10 code popping up in that group of people. So we didn't go into age of onset or any measure. I don't think you even could measure severity. Everyone who was in biobank had baseline cognitive tests when they enrolled, which were a computer, kind of a tablet-based test. And we did look at the different groups, but we didn't see any difference in the cognitive tests at baseline, but you maybe wouldn't expect to.
Got it. Thank you.
Any other questions?
Can I ask the dumbest question, and I apologize to everyone for sounding like an idiot, but does the ISD-10 codes, are those universal or are they only used in specific countries? Like, is that something I would refer to in Canada?
Canada, we don't use
That's what I was wondering, because I couldn't,
It depends on the province in Canada, so not necessarily the coding that you use in Ontario would apply.
I'd never heard of it through my family members' disease, death. The ICD-10 code, I just heard about through Sisters Hope. So it's for me, very interesting. I wrote it down to start telling all my doctors, but it's like, is it worthless to give them info that doesn't relate to Canada?
Yeah, I mean, it's only used for billing. It has no other value, really. We don't use them either.
Really? Oh, thank God we don't have to worry about that then. I know Dr. LaFiana a lot of money by now.